Very much. I want a huge round of applause for our teachers. Yeah, thank you very much. They deserve it when they have taken. They're all very busy persons, and they have taken their precious time out to spend some time with us to guide us through their experience, knowledge, and their wisdom to see the future. So the format is like that. We'll keep it open-ended, as open-ended as possible. Maybe we'll ask a few questions. The questions might or might not be directed to someone specific. For instance, if you are asking questions regarding psychology training, so we'll direct that question to Professor Dwarka Prasad. But for others, maybe we'll keep it more open and would like to be more interactive, like Swapnajeet. Yeah. And we'll also encourage the audience sometime to ask questions. If you have any questions, please feel free to tell us. You can directly ask those questions, or otherwise, we can ask those questions on your behalf. Um, so this is basically a kind of a journey. And when I say training in mental health, is specifically, okay, right. So when we talk about training in the mental health here, it's kind of, we are talking about specialty training in psychiatry and psychology, um, not particularly mental health training of uh, other layperson or frontline workers. So there are three components. There are three major areas which we'll like to tap into. The first one is how was the training before? Kind of a qualitative account, not in terms of whether the training was very good or very bad, uh, but kind of more experiential, qualitative account, a narrative account from our teachers. How is the training now, or what has changed over the years? Uh, Again, what are the good things? Again, a narrative account of that, because all of them have been uh, have headed some of the departments, some of the major departments of the institutes, and they have a huge experience in this field. So, how did they go about this training? And then the future, looking ahead at the future with their uh, wisdom. So how would the training go in the near future? So then we'll start with the first round of.
I would like to first request Professor Kulhara sir to say something about what were the core components of training during your residency program when you were a trainee resident in the department.
Yeah. It's a very good question, but does not mean that the answer has also to be very good. The problem from my side in answering that question is that we were probably the first formal group of trainee psychiatrists. So for us, we were inexperienced children, and perhaps our teachers were also inexperienced parents. But through the inexperience of ours as well as the guidance of our inexperienced teachers, we learned. What we learned is psychiatry. What were the core competencies that we are supposed to learn? I have no idea. But what we learned from our teachers was the art of communication, the art of clinical psychiatry, how to talk to patients, and how to deal with their problems. And that was the core competency. Communication, understanding, and trying to solve the problem. Because in those days, drugs were very limited, psychotherapy and other things were also very limited, and structured program was also very limited. So what we loved most was the unstructured nature of the program, and what we loved most was discussing issues with our consultants, with our teachers who were generous enough to give us time, and our seniors, the registrars, Dr. Roshan Lal Naran, Dr. B.R.S. Naukra, Dr. Bahadur Chand Khanna, who spend so much of their time with us trying to teach us. So that's all I can say. What I like most, almost everything. What I didn't like most, nothing much. Thank you.
Thank you, sir. Thank you so much. The same question I would like to ask Professor Dwarka Prasad. Sir, what were the core components of training in the psychology program uh, of the department during your time?
It is a great pleasure to see that a galaxy of retired professor, retired head department of psychiatry are sharing a common platform, and I have been given a place to sit with them. I'm a psychologist. And when I was a psychologist here in the PGI, we developed a number of psychological tests, and people used to call that PGI group of psychologists are saying so and so thing. And when they say group of psychologists, we were only two persons, myself and Dr. S.K. Burma. And Lemans were having at that time more than a dozen of clinical psychologists. And they were not the group. We two persons were a group. And we developed a number of psychological tests that are very famous in the country. Apart from that, we motivated other department of psychology, other department of medicine to have a clinical psychologist on their road. To name few of them, ENT department, pediatric department, neurosurgery department, anesthesia department, and we have been doing research work along with them. As far as teaching is concerned, we have been teaching neurologists, pediatricians, ENT people, and there was a time when we started a course in physiotherapy, BSc physiotherapy, BSc speech pathology, and we were asked to give in writing a undertaking that we will look after the teaching work. And we gave it in writing that we will look after the teaching work of BSc nursing and BSc speech pathology and BSc pathology. And after 2 or 3 years, we say that now it is not possible for us to continue it because of our own pressure in the department. And they engage their own clinical psychologists. This is the clinical psychology advancement during that time. Now, what is the status of clinical psychology? This I do not know. Thank you very much.
Thank you, sir. Thank you so much for your words of wisdom.
Thank you very much, sir. And sir was the sir during his time developed the PGI memory scale, and which kind of all of us have been using till now. So yeah. Now, when Dr. P. Kulhara have spoken about unstructured nature of training, that he liked it very much, the unstructured nebulous form of training. So my question to Professor Malhotra would be, do you think that which of these training modes to it's an unstructured or the structured mode of training? And what are the differences, pros and cons of it?
Thank you very much. I'm so happy and pleased for this very unique and innovative, session that we are holding here. And we are required to, or have been called upon to share our own personal experiences as a trainee in the department, and talking about what we think about it. And I would start with first of all just my paying homage to my teacher, Dr. Enelbek, teacher mentor who was there, who is not amongst us today, and Dr. V.K. Verma, who could not be with us today. I was trained under Dr. Vik, Dr. Verma, Dr. S.K. Verma, and Dr. Dwarka Pershad. That was the kind of faculty at that time when I was a student. I joined in 1974 as a house physician in PGI. And when I joined, I think, of course, came here to learn psychiatry. But at that time, I had very little idea about psychiatry. I knew that the subject is of interest to me, and very little, and even less little idea about PGI, except that it was the closest place to Shimla, my home at that time, to pursue PG studies. So the closest for MD psychiatry place, that was PGI, and I came here. And joined as house physician, then became junior resident, and so on. I think the first 6 months as house physician, they impacted me very significantly and majorly. Coming from a place like Shimla, I have lived my earlier days and schooling in Punjab and Haryana. Now Punjab, Haryana. That time it was undivided Greater Punjab, and small towns. And this place was very unique and very special, PGI. The system here, the discipline, the format, the authority, the power it exuded. When we had our counseling in LT1, starting from entrance test, and then interview in the department, and then counseling in LT1 with Dr. Chotani, Dr. Aikut sitting there. And this had such a powerful impact on me that this is, look at the place, this is how the things are conducted, and things happen. And was very fortunate that I got admission and came in here. And after joining residency, very soon again, I realized, and I thought that this is the place I could spend my entire life in, even if it is only at this level of senior resident. MD पास करके SR बन जाओ यहाँ पर और जिंदगी गुजार दो, बस ये अच्छा है, सब कुछ है और कुछ चाहिए. Very low, very little level of ambition and things of that kind. And what the department embodied, of course, we learned psychiatry. Psychiatry, our teachers, they were absolutely fantastic. And clinical psychiatry, that is learning of phenomenology, learning of diagnostic process, learning of treatments, that was great. But in addition to that, in addition to learning core clinical psychiatry, other things which impacted and which I thought were very important was one, is the doctor-patient relationship and communication with patients and families. How to elicit, how to talk, what are the ethics, and how to make the patient comfortable, and so on. So that is one aspect that was very, very special and unique. And we were at that time required to write histories and report verbatim. So our effort was always to kind of make the patient speak about the inner experience, the felt experience that was elicited from the patients, and that was recorded as such. And then we would kind of go back and discuss whether it fit, where it fitted into our fish psychopathology, and so on. So the verbatim recording. And other thing that I learned and which I found unique were this kind of a process of analytical thinking deep, thinking beyond what is evident or apparent or is just written, and thinking, very, very analytically, logically, and even beyond sometimes what is written in the books. So that was the other thing that was very, very impressive and very good. And of course, what was very, at the personal level, we had a very good interpersonal relationships, very close bond between the faculty and students and us. I would say that we were at that time pampered with attention. We were very, very well taken care of, even for not only our professional or our work-related problems, but also personal problems. And we were, we never scolded. Not that any opportunity arose, but then it was just enough if Dr. Big ever said that you should have thought about. सोचना चाहिए. बस उनका इतना ही कहना है कि तुमने ये सोचा नहीं, ये सोचने में तुम चूक गए, सोचना चाहिए. That was enough, and then we would just kind of carry on from there. And of course, this was a hard grind. It was a very rigorous training and a lot of high expectations. I mean, we were always required to perform beyond our what we thought was our ability or level. And so this continued, and this was excellent, I would say. And we maintained a very good personal relationships, and and I would say that from the residency time, when I became a faculty member in 1979 as a lecturer at that time, and Dr. Wig left in 1980, and for some time Dr. Wig, myself, and Dr. V.K. Verma, we were the three psychiatry faculty members, because Dr. Ghosh left, then Dr. Murthy left, and Dr. Kala left, and then we were just left, the three of us in the department. And that was the golden period and best of my time, and still relish and remember that. Dr. Verma left in 1996. And then after that, what has happened is that the things started changing. Department became very big, it expanded. Also, things started changing with regard to the times changed. The times changed. Doctor-patient relationships changed. It became more consumer-oriented. We from healer we became kind of more, contractual kind of people who were delivering a service which has been bought over by patients and things of that kind. Same ways, the patient, the student-teacher relationships also changed. The students now, I think, is a very different generation. They are much more aware. They are exposed to life and world much more than we were. We were very naive, and we knew very, very little. I mean, at that time when I joined PGI, when we were sent to Nimhans for posting in 1975. And that was the first time that I had undertaken train travel. The first time I had gone beyond south of Delhi. I had not interacted with, before coming to PGI, with the people from different region and their different languages and culture background and so on. So this was a total kind of unfolding of a world, so to say, when I came to PGI. But now with the residents who come, they already are so very well exposed to the world, aware of the world, they are aware of their rights and everything. And so they don't need at this time more paternalistic guidance or help at the moment. That's what I think from a distance. I'm no more actively working now here. And but nevertheless, I think I would say for me, this has been an experience and the pleasure of my life. And I would be always kind of grateful to my teachers, my colleagues, my students, my patients for everything, and because they have contributed to my professional growth in every way. Thank you very much.
Now my next question will be to Professor Avasthi, sir. Sir, is there anything which you felt that it would have been added in your training program at your time, which you feel now that it would have been added at that time?
Well, thank you very much, Dr. Swapnajeet sir. First of all, let me clarify, this is no attempt to make myself look very distinguished, which otherwise I am not. It is just I saw Dr. Shubhmohan Singh walking with a shawl on his shoulder, and I'm feeling very cold because there is a full blast of the AC above my head. So I felt that borrow it from Shumon and make myself feel comfortable. Now that epitomizes the relationship between a teacher and a student. Even now, the teacher is a retired man and the student is in an eminent position. But I have no hesitation exercising my right and authority, and he has no greater pleasure than accepting it. So I think not much has changed. The relationships remain the same, provided you think what you are and what others are, and you learn to love and respect each other. Before I start, I think there are 2 or 3 things which I need to do. First of all, besides the galaxy of people with whom I am sharing this dais, I would like to express my deep gratitude. In fact, my words cannot express it adequately, to my very great, eminent teacher, the man who has shaped my life, Professor R. Srinivasmurthy, sir. I will also like to express my gratitude to the man who held my fingers for the first time and led me through the maze of the department and instilled in me the certain sense of learning. And that is Professor Sudhir Khandelwal, sir. When I joined as a junior resident, he was the senior resident in the ward, and I reported to him. And my first lessons of post-graduation in psychiatry started sitting at his feet, to say it literally. The other people, 2 eminent people whom I see, because they also contributed immensely to my learning, both of them were my seniors, Dr. P.K. Singh and Dr. Santosh Chaturvedi. So they also were the ones whom I would talk to. We'll talk about patients. Santosh was 6 months senior to me. P.K. Singh was, I think, 1.5 years, 1.5 years senior to me, 1 year senior to me, likewise. But they were the ones who contributed. And then, of course, I had a galaxy of my friends sitting with me who were a shade junior to me, 6 months, 1 year, and they are now eminent people here sitting. If I take their names, then almost I would have to name the half of the hall. So people sitting there. Having said that, I think the larger question which you have asked me is, what were the things which impressed me when I entered this department in terms of the teaching program? And I'll confine myself to that. And I'll give some snippets to give you some feel of what was happening at that. My greatest joy, and that's really an eye-opener for me, were 2 things in the training program. One, the psychotherapy lectures by none other than Professor B.K. Verma. Nobody could beat him. And that gave us some kind of an understanding as to how the mind works. He will make us think. And that was amazing. And not only just theoretical aspect of it, there will be psychotherapy supervision classes also, where we will do the psychotherapy, present to our faculty, and then there will be some discussion. I still remember how myself and Santosh would, between us, decide that we will not let this psychotherapy session go beyond the first 2 sentences, because we had no other case to offer, and we'll keep on talking about the same case over and over again after each session, Oh, that was a clever ploy. But then, even in that cleverness, we will learn something. The second thing which really impressed me was, and then it will be seen that those precepts of psychotherapy were actually put into clinical practice while we were presenting our cases, and also when we were discussing the progress of the cases with our teachers. That was a very amazing experience. The second was the field experience of going with Professor R. Srinivasmurthy, going into the field, away from the clinic, and going into the field and interact with people in their homes or wherever in their communities, and understanding their problem in a very empathic way, and then trying to reach out to them. And that was something, again, which was a very good experience for me. I think the troika of Vig, Verma, and Murthy, and of course, people before them, they must have also. I have seen only three of them, and of course, Dr. Savita Malhotra. The three of them, they must have worked very hard to bring about a program, a training program, to which maybe some others had also contributed before that. But I believe there are three principal players who made the training program, which so many years later, when I became head of the department, and I had set for myself one objective, I'll upgrade the free teaching training program. Let me tell you, ladies and gentlemen, the program was such a fine, perfect model of training and teaching that I couldn't improve upon. Despite my best discussions with others, my thoughts, and actually the teaching training program of PGI became a model to be replicated elsewhere also. And that's a fact. People may not acknowledge it, but when you look at the teaching training programs of so many training centers elsewhere, you find the same imprint of it. Now that's something which is remarkable. How beautifully they had worked about it. The whole comprehensive plane in which they had chalked out the program, which instilled in you the best quality of the patient care, the learning of the almost all aspects. Who had thought of, and in how many centers? People were being sent to neurology for training. There were psychosomatic rounds with medicine, surgery, pediatrics, dermatology, gynecology. Where else it was happening? The consultation liaison, the way it was being practiced here. So those were the very strong points of the program. And of course, a lot of emphasis. If it started, I'm sure, when Dr. Kulhara joined, it was there before also, but Dr. Kulhara gave a tremendous impetus, and that is where my learning started in a different way. And that was in research methodologies. The kind of research he initiated at that time is being followed till date. We haven't progressed beyond that. That empirical research with the kind of the statistical methods being employed, such advanced, the clinical research I'm particularly referring to. And then phenomenology, the emphasis on the phenomenology, and that gave us the insights that how to look at patients. I'll just give you two or three things, tell you a little more. When I talk of teaching and learning and a teacher-student relationship, I'll just give you one example. With many of you I've shared, I used to go for doing my own research work at Court Billa, with which Professor Murthy had no association, so to speak, except that he said that, why don't you do it? When I had refused to do that. Professor Murthy knows it. Now, I would go to his house in Sector 15, have my breakfast there. I will sit on the carrier of his bicycle. We'll reach the bus stand in Sector 17. We'll board the bus. He will pay for my fare. I will get down at Port Villa. He will go to Raipur Rani. He will return, make the bus stand, stop where I would be standing. Pick me up again. He will pick up his bicycle. I will sit at the carrier. And he will drop me. He would offer to drop me at PGI, but I will insist, no, I'll walk from Sector 15 to PGI. Those are the times. How many teachers would do that with their students today? How many of them have the willingness, the generosity, the belongingness? I particularly like to remember one of the teachers of this department who is no more with us, Professor Anil Malhotra. The kind of love, affection, care he had given to me in person, I cannot forget it. I will be consulting him for things like how to fix my fridge, how to fix my scooter, and so on and so forth. How many students and teachers would go together, like him and me, to get our scooter serviced at a particular mechanic? Sector 7, boxing, yeah. So we will go together. We'll fix up on Sunday. We'll go together. That is something to be preserved. So that is something. I'm just giving you some of the examples. The second thing which I remember is, if I can say, the vision, the capacity to look big, that's something, to look at things in a larger frame, as we used to call at one time 70 screen, that was Professor Big. Methodicity, how to be methodical. I will draft a letter, give it to Professor Burma. I would have written my letter in blue, with blue pen. When I will receive back my paper, it will be all red. He would have looked into each and comma, full stop, what word, what not to be written, something. And then I will have to revise it, send it back to him. This is how I learned to write my first publications. My first letters, how to draft those even ordinary letters. And I will make it a point to go to him to show him. So, methodicity, how to be so methodical. And of course, how to be a man of action. The great man sitting there, Professor Murthy. Well, Dr. Savita, my teacher at that time, was full of joviality, fun. She was the one with whom I felt most comfortable with, to relate at a personal level. And so often we will be spending our evening together at her home. So those were the, the relationships. And that was the kind of, and of course, if I talk about my juniors or people who were a shade junior to me, 6 months, 1 year, there are so many things to talk. Chadda is already shivering, lest I may say something, So there are so Roy, for that matter, Ajit Prasad Rao. But then the same trend continued for some time. So these are the good things. Coming to your specific question which you put me, what was that?
So what you thought was
this is yeah, he has also forgot. You have forgotten?
No, sir.
No.
So what you thought was lacking at that time?
What was lacking at that time? Honestly, as Professor Kulhara put it so well, he uses his words in a very parsimonious way. And I learned for the first time what is parsimonious while I was, reading about the anarchistic personality, that time, in a very parsimonious. That is, he said it in so many words that I can't think of anything which was lacking or which could be, as I told you. But still, you have asked me that question. I think we should have had more technology flowing into the PGI at that time, because the trends were visible. The organic psychiatry, or the biological psychiatry, was actually making advances at that. I think we had some kind of a lag, because, and PGI being a very traditional place, which is its strength, I will not consider it weakness. It's a traditional place. New things, new ideas, it takes some time to be accepted. So we should have had more, investment into the biological psychiatry at that time. I think that is one thing which I would say. And the second, largely because of the limited manpower, department was small, limited manpower. We couldn't stretch our hands and feet that much. But I wish if licensed psychiatry would have taken this, because it still has not come up, neither here nor elsewhere in the country. And we have been talking about it for the last good 50 years now. So that is the two things. And I see future of psychiatry in that case. Thank you very much.
Thank you, sir.
Thank you very much, Professor Avasthi. That was very intense, and thank you for sharing your own experience and a lot of anecdotes. Now, our question is for Professor Chadda, who is the head of the department in All India Institute of Medical Sciences, New Delhi now. And because Sir was trained in the PGI, Then he went abroad. Then in the UK, he was there in the UK for some time. Then he came back, and he was working in one of the Delhi University medical colleges. And then he joined AIMS. So he had kind of a lot of other experiences as well. So how those experiences and the PJ experiences, the postgraduate psychiatry training, were different from each other, and how do you kind of compare? Over to you, sir.
Thank you, Abhishek. I joined PGI in psychiatry in January 1983. Before that, I had worked for about 5 months in anesthesia. As Dr. Savita Malhotra was mentioning about the entrance exam, used to be for first year residency and then second year and third year. So there were two, I was from the last batch of that. And first year entrance exam used to be held in Bhargava Auditorium. So you can understand how while sitting on this chair, you are also having a answer sheet and question paper. How would you be taking the answers in the MCQs? So that was the first visit to PGI before you join. You got the residence, got selected as first year junior resident. That was the house physician, and then the formal PG, that was the second year. So that was the thing. It was when you entered PGI, entered the department, it was taken as a great achievement for yourself. Because coming from a state college to PGI or AIMS, that used to be a dream come true. My first teacher, my first encounter on that 1st January 1983 was with Dr. Savita Malhotra. Dr. Verma was not there on that particular day. And Dr. Savita Malhotra referred me to Dr. Roop Sadana, who is sitting on the front row. And he handed me over number of sheets, history taking, definitions of psychopathology. And he also took me to the library. There was a department library. He told me that what are books I have to start reading. So my first clinical teacher was Dr. Roop Sadana. Though he was not a regular senior resident at the time. He stayed there for only 2 months. Then Dr. Avasthi took over after 3 weeks. He was posted in the ward. And I did my first case conference, I think, March 1st week. It was just 2 months of my so-called house job or first year yearship when I was given the first case to present the case conference. So I think making clinical presentations, seminars, that was one of the unique experience here, and that gave me a lot of confidence in public speaking, academic presentation. That was one of the very important learning which I had. As Dr. Avasthi mentioned about writing letters. In fact, writing letters for the patients, I remember Dr. Savita Malhotra told me that there was a patient who had been admitted, who was under treatment with Dr. Narang in Ludhiana. So he said, you write to him to get the case history. So I wrote that letter, drafted that letter, then it was approved by Dr. Savita Malhotra, and that first by Dr. Mattu probably. And then I sent it to Dr. Narang, though we did not receive a reply. But these were the things which were unique at PGI. We were able to open, we could ask any question to the seniors. I still remember taking one of the old case files in which Dr. Kulhara's notes were there as a junior resident. And I asked him that you written these two medicines, there was written trifluperazine as well as chlorpromazine. So that was generally two antipsychotics are not given together. So these kind of questions you could ask your teachers. That was the uniqueness of the department. many learnings from the department I took over to my later places where I was, where I worked. For example, when I joined UCMS, I joined in September 1988. And that was UCMS actually had shifted to the new building. Earlier, it was attached to Safdarjung Hospital. And in the month of December, just before vacation, I was asked by the Department of Medicine that you have to take lectures of the undergraduates. And this is a period of 3 weeks in which you have to take the complete slot. That's whatever you, how many lectures you would like to take, 13, 14, 15. So will you be able to take those lectures? I said yes, I'll be able to take. Now here it was a PGI's training that had helped me to prepare those lectures for the UGs, and I took those lectures I think within 3 weeks or 4 weeks, and so preparing 13 lectures for the undergraduates and doing it within 3 weeks. So that was something which I had learned from PGI, which helped me. Dr. Avasthi was telling about other things which you learned here. Dr. Avasthi, taught me how to drive scooter. He also got me, of course, it was my money which I used for purchasing. He did not give me any financial help, but he helped me in purchasing scooter. Those days, scooters were like Bajaj was not a regular booking. You have to purchase it in a black market to pay some extra sum of 3,000 or 4,000 rupees. So although all the that kind of work was done by Dr. Avasthi, so that was the kind of relation we had with our seniors. Similarly, I remember another very important. I had gone to BPK Institute of Health Sciences, Dharan, for 5 weeks, and I was asked to complete their lecture schedule because this was the first MBBS batch, and they had just reached the second prof. I think third year or fourth year, whatever, third year actually. So I asked to take their lectures and finish within those 5 weeks. So first thing I did that I got that opportunity that I could do the pre-assessment and the post-assessment of these students. Means I prepared a questionnaire within there itself within 24 hours, got it photocopied. I requested the administration academic section there. They got me the photocopies. I did the preliminary pre-assessment, then took lecture, then do the post-assessment. No, there was a head of the Department of Anatomy of UCMS who was there, who had also gone there as a visiting faculty. So his first comment on that was, "Are you MD from PGI?" Because it's the only student from PGI who can prepare a questionnaire like that. So that's the kind of training which he had received from the department. Another very important another thing that when I joined UCMS, at PGI we had just started during my SRship. The printed pro forma had been started as a clinical case sheet. So similar kind of case sheet I introduced at UCMS, where I started the department. Then at IBHAS, there also I introduced the same kind of sheet, and at AIIMS also in 2005 when I joined, I think within a month I requested Dr. Ray that our residents are often not following a formal structure for assessment, because many times sometimes they miss something in MSc, something in the personal history. So should we go for a printed sheet, printed pro forma? So he said, okay, go ahead. So I was able to manage that, get that printed by talking to the MS. I was able to use my personal relations, my old personal relations, because the MS was my junior during my MBBS days at Rohtak. So I think within few weeks, we were able to introduce, to get those printed, those case sheets printed, and we started that in 2005. Now, AIIMS Psychiatric Services had started way back in 1962 or 63. So those are the kind of learnings which I had, or which all the residents used to get at PGI. Thank you.
Thank you, sir. Thank you so much. Now my next question is to Professor Roy Abraham. Sir, since you are from working in a private setup, So is the residency training program in private setup different from the government setup, and what all problems do you face in private setup?
I am working in the private sector only for the last 10 years. For the 30 years, I was in the government sector. So I joined, I belong to 82-84 batch, just senior to Rakesh. And when I joined here, it was a sort of a dream come true. Very few people from the south, especially from Kerala, hardly anyone from our state had ever been admitted. When I was given admission, the then director, I particularly did well in the interview. I still remember. And in I was a captain of the college debating team. So the Dr. Pathak asked me a number of general questions for which I answered. And suddenly he declared, we will admit him. He will become our ambassador in a faraway state. I still remember those words. But once I got admission, I had a very tough time because I neither knew Hindi nor Punjabi, and I could neither talk to patients. Very extremely difficult. But I think my fellow PGs helped me a lot, especially Dr. Sudhir Bhave was my Hindi teacher. The senior Sunil Mittal, Pratipal Singh Gill, and then later Rakesh. They all helped me. Even case taking was extremely difficult for the first few months. And then, of course, the rigor, although there was probably, there was no, even if you claim there was no structure, there was a definite structure in the PGI teaching model. One thing I can definitely remember is not even for one day I have taken a leave. Every day I was in the hospital. We come at 8 o'clock and leave. Avasthi was our senior resident at that time. Sometimes we used to leave after presenting cases to him after 8. So that was a type of work. The only time I took leave, I landed up in trouble because I had a public service commissioner interview in Kerala. I was posted in neurology. And then I asked the neurology professor, J.S. Chopra, he said, you cannot. Then it was my career opportunity, but I had to go. So I had to skip without his knowledge. I thought he will never know because I had arranged with those assistants there, Upinder Kaur, Prabhagar, and all they said, nobody, he will not notice. You just take a flight and come back. So I did exactly that. But just before the examination, Varmaji called me. Roy, the neurology professor, is asked for repeat posting in neurology. So that is a very, very deadly blow to me because I cannot even go back to my state and join the service. So I asked Varmaji at that time. Varmaji said, "Kya bhaiya, aap kya kar sakte bhaiya?" Like that. He is sometimes like that. He someday, although he is very loving, he just said, "It means I cannot do anything." Then I approached Dr. Kulhara. That's why I never forget him. I told him about my plight. Then Dr. Kulhara, then personally, he took me to Dr. J.S. Chopra. Then introduced this Chopra Saab, you know this man? Then asked me to wait outside. And then after he talked with Chopra, persuaded him. And then Chopra said, I will give him a neurology examination. He passes, then okay. Then of course, he gave me an exam. I was lucky to pass. So these are some of the memories. Later on, after going from PGI, I worked as professor and head in 3 government colleges. First in my alma mater, Government Medical College Kottayam, Government Medical College Thrissur. Later I became principal at the Government Medical College Kochi, Ernakulam. And later now in Pushpagiri Institute of Medical Sciences. So the entire teaching program, I almost copied in all these colleges for PG. I started the PG program in each of these colleges. And the MCA inspectors were somewhat surprised by the order and the structure, which was in all these colleges. And we had no difficulty in getting recognition. I'm very happy that the greatest achievement that we could train more than 50 MDs. I have been their teacher, thesis guide. That has been one of the greatest achievements for all this. I'm obliged. And personally also, everybody was grateful. I still remember during my MD examination, Dr. Avasthi came to me and asked, Roy, is everything going on well? Are you able to understand the patient, what he's saying? So that was a concern. Although he did not give me any tip, he still wanted to make sure that I am comfortable with the patient. So that is the type. And I also remember Rakesh, who is sitting here. He was very, extremely helpful to me and supportive. Thank you very much.
Thank you, sir. Thank you. Now my final question is to Professor Rajiv Gupta, sir. Sir, what obstacles did you face, particularly in setting up the psychiatric department at your center, Rohtak? Because that is totally different. It is from a central institute. And so what obstacles do you face while setting up the department there?
No, I have not set up the department. First, I must clarify. The department was there. I'll just share with you, that things, my teachers are here, and they have shaped, and the training which we got here, I think you can do anything. Wherever I went later on, and, I am heading the department for the last 15 years, and all the programs which we are doing here were translated there, and I could do that because of the training which I got. I will just share you 2-3 snapshots from my residency program from 1985 to 90. I was here. 2-3 things which, apart from what Dr. Savita and Dr. Kulhara and Dr. Avasthi has already, and all of them had, I totally endorse that thing because that was the period 85 to 90. That was mid period, if we are talking of 60 years now. So that was almost the midpoint of the period of the department. And those things were the department was small. We have only 3 main consultants at that time when I joined junior residency. Dr. V.K. Verma, Dr. Kulhara, and Dr. Savita Malhotra was there. And we have senior resident, my senior resident, Kishore, and Dr. Bhave sitting, Pershad Rao, and Achal, and Dr. Chadda, and all we were of the same period. We were trained in the same period. I remember 2 snapshots I will give you. I was just chairing a session in the LT2 where we used to have a case conference, and that is totally transformed. There's a panel, glass panel there, and we used to have epidiascope. And at that point of time, when we were trained, we were not having these gadgets, that mobile phones and smartphones. And no, even digital clocks were not there in the seminar. I took a round with Dr. Basu when I came for examination. The department has said it's totally modern. At that time, we used to know I remember Dr. Verma used to come, if the class is at 8 a.m. morning, he will come 5 minutes to 8. He will remove his wristwatch and place there. And that was the time, discipline of time, which I think, apart from the clinical training, that was a very important thing, that if the thing has to start at 8 a.m., that it will start at 8 a.m. And he will go by that watch, which he used to put on the table. And other things which, I still remember, those apart from the teaching which have been covered by, those things were carried on during that period very nicely. Both the teaching program were so robust and so nice and so enjoying the junior residency that everything we used to enjoy. Apart from those things, I think I remember those breaks, round coffee rooms discussions, which were widespread, the current topics, and they were very enjoying apart from those things. And I think I still remember, I think the approach which the consultants had, that Dr. Kulhara was my guide, and the approach and the questions which you can ask him even while walking on the corridors or going to the 5th floor for tea with him. And he used to take us, chalo chai pine chalte hain, round rooms, and we used to enjoy those talks. Plus, going with him on that small car to Raipur Rani, that was a small car, and having those breaks. And on the way, we used to discuss so those things are very important things, which were very different from, I don't know whether other institutes were having it, but that was the very important learnings which I had, and I still continue those things. And, those 5 years were great shaping, and those, for example, Dr. Verma's teachings, Dr. Kulhara's, mentorship and all, Dr. Savita, those things are very much, impregnated in your mind, and those things we are still carrying on. And that is very wonderful journey, which gave us strength to know to whatever now when we are talking of now, and NMC have given us skill based training, and they are splitting all the components. We used to have those things, I think, very meticulously trained, and now we are splitting those things. I don't know how that are helpful, but I think that the traditional training which we had was far superior to what we are trying to do with that splitting of everything now. The only problem which you are asking me, how the things are changing now, and obstacles are many now, because the things is, earlier we used to have few residents, 4, 5 now we have 10 residents or more than 10. So it is a 30 resident, training them, and clinical material is short. We can't handle the thesis and topics, research, which is very difficult now. So that is one thing which is coming up, and of course other things. For example, at our time, we used to we don't have these slide projection. Seminars were handwritten, and we were just now there is all those things have changed. So there is a rapid change, information technology, and the things are changing, and we have to cope up with that. But I think still those traditional routings and that training has helped us to help me to run the program very successfully, and doing all the government programs and attending those programs and things that has given a lot of strength, and that is because of the training which we had in PGI Chandigarh. So that's what I think, and I must thank all my teachers and all those who are here, who has shaped my career at that time to give me strength to go to travel this journey very comfortably so far. Thank you.
Thank you, sir. Now, because we have limited time, so I would like to ask in the reverse sequence some few brief bulleted 2 messages for the current generation psychiatry trainee, which they should imbibe in themselves so that they can carry ahead the legacy of psychiatry in when they will become the teachers. So, what are your points? Any 2 important points to the current generation of psychiatry residents, faculty, training?
I think I think 2 things are getting diluted. One thing, that discipline, time, commitment. So I think if we can just frame, I think time management or discipline, that is one thing, and what Dr. Kulhara I will said, that communication skills, we are losing that because of the virtual communication. We are getting more adept in the newer generation, and the talking to patients, communication is getting down, and that is why most of the doctor-patient violence which we are seeing in emergency, or because the new generation of doctors and residents, they hardly have that the communication skills, empathic skills which we need. So these 2 things I think I am finding which are missing and getting diluted and going away. So I think they should be taken care of.
Thank you, sir. Same question is to Dr. Roy, sir. So what would you like to advise to the current generation of psychiatric trainees?
My first advice is you must be carefully listening to our patients. Our case history is a good instrument for that. So that starts the big bond which is going to develop for many years to come, and most patients will going to remain with you for years or till they become fully better, and even if they have a relapse, they're going to come back to you. Secondly, I would say that let's not prescribe too many drugs. Drugs have their own limitations, and drugs have no answers for everything. Thank you.
Thank you, sir. Chadda, sir.
There would be some repetition. Your patient is the best teacher. Spend adequate time with your patient. That's very important to learn clinical skills. And second thing is, because the medicine is getting more and more complicated, so we need to be careful about maintaining ethics in clinical practice. we need to follow the whatever the norms, local norms of the medical council. These days we have the National Medical Commission. So because that's also very important. So, and we need to be familiar with the local laws, like we have Mental Health Care Act. So whatever local laws, we need to be very careful about that we don't breach any of the laws.
Thank you, sir. Avasthi, sir.
Well, I think there are two aspects to your question. First of all, we need to have fearless, committed, passionate teachers. Don't worry about what others think of you. You are not standing for an election, right? Whether you are rated as good or a bad teacher, that is others' problems, depending upon their experiences and their personalities. You do your work, your honest piece of work, to your best conviction, and feel happy about it. That is my first thing. I think the biggest problem now today is that teachers have become so defensive. It's not only doctors, the teachers are getting defensive. So they should not. They should. If you want to be a teacher, be a fearless, committed, passionate teacher with best interests of your students in your mind. That's the spirit that you need. For students, they must have a lot of curiosity to learn, a tremendous curiosity to learn. If they have no curiosity to learn, they need not enter the portals of this profession, because this profession is highly demanding profession. And for that, the ultimate factor is the welfare of the patient. For that, please try to understand the stories of their life, rather than just looking at them as some kind of an objects which need to be fixed. They're not broken objects, they're not broken toys. There are stories of them. They're very organic wholes. So those need to be looked at. As far as the teaching and training programs, I would say that all over India now, we should, as they say, keep the best of our past, at the same time, get the best of the new also, the future. So don't lose on your strengths, like your strength of the community psychiatry work, your strength of the talking to patients, communication skills, psychotherapy, the biopsychosocial approach to the patient care and understanding. All those things must be clinical psychiatry skills and those things. At the same time, please embark upon the understanding of the brain. And my last thing is to say, I would like to bring back and not lose out to neurologists on the care of epilepsy, dementia, and to pediatricians, what they call as developmental pediatricians or whatever they call themselves. So neurologists, the care of the people with learning disabilities, as well as autism and other problems. So please don't lose on things which as a profession we are losing. Bring them back, because you are better equipped, not because it is just to increase the number of patients with you. Your training, the total ethos of your profession equips you better to deal with those patients and their families than a neurologist. Thank you very much.
Thank you, sir. Savita ma'am, any points you want to add, particularly related to research during the training, what you want to advise the newer generation?
I think I would like to focus on in training for students, two major things. One is empathic listening, focused empathic listening. This is a humanistic kind of an approach and understanding and of patients and handling of them. So empathy is a very important clinical skill, and that we should all have, all the students should have. And other is in their working and formulation to have a developmental and holistic approach to understanding of the patient. Absolutely holistic and developmental. So now we are focusing more and more, because psychiatric disorders, patient may come at any stage of his life to us, but that is not when the problem started. Problem started somewhere else. And then we need to understand in a developmental framework and holistically about what is wrong and how to manage it. That is it. And of course, now we must also shift focus also towards understanding and study of the brain. Brain and psychiatry, mind, this kind of an interface and understanding is becoming much closer and much greater. with the new knowledge and so on. We should become more and more kind of rooted in terms of the underpinnings, the neurobiological underpinnings of psychopathology and all the functions of the mind. Thank you.
Thank you, ma'am. Kulhara sir, any brief comments?
What is your specific question now?
So what is any take home message to the trainees?
Okay, take home message. First of all, I mean, rather than addressing the so-called students or trainees, let me address one issue, which I don't think anybody has touched, and I think that will make me most unpopular. How many of you, when I say you, teachers, trainers, clinician consultants, supervising teaching and training, how many of you are really doing your job to the best of your ability, honesty, and competence? Unless you put in that sort of a commitment in your training program, then no amount of advice by me, Ajit, Savita, Dr. Dwarka, Pershad, that's not going to be effective. So, first advice, be a good thinking, feeling, empathic teacher. To the trainees, just one short advice. A person who walks into your clinic is not a bundle of symptoms who comes and parks himself in the chair in front of you. And you look at him and say, oh, you have so many symptoms, so I'll advise you treatment about symptoms. For God's sake, the person who has come in is a human being. And symptoms in military terms are just a smoke screen. You have to look beyond the symptoms that the patient is presenting and look at what his real problem is, which is manifesting in a symptom. This is more important because we now are living in an atmosphere where almost everything is passed on to lifestyle. A lifestyle change, lifestyle stress, lifestyle that, giving rise to X number of diseases. And what we are doing, we are just treating the symptoms. So please give up this symptomatic approach. Patients are not tick marks that are you sleeping well, you feel anxious, you feel depressed, are you passing your motion or not? And 6 ticks, 6 medicines. That's not psychiatry. So change that. Thank you.
Thank you, sir. And the last question is to Dr. Dwarka Prasad, sir. Any comments you want to give to the young psychologist?
Advice to young psychologists. Any advice to young psychologists?
Two type of training is very important for psychiatrists in the psychology. One is didactic lectures and another is practical training. And in the PGI, we have been conducting both type of training in the sense 15 lectures per semester and 15 days training, practical training. And this has raised their knowledge about psychology. And I'm not very sure, but most of the PGI psychiatrists are much better in psychological training, and they can do a better job. Once there was a case who met with a roadside accident and was sent to psychiatry department for assessment of IQ. And a psychologist write 100 IQ. Then psychiatrist asked, what was his pre-morbid IQ? And then the psychologist said, How do we associate? And then psychiatrist told academic achievement, professional achievement, social achievement. You collect history about these things and then tell us what might be his pre-morbid IQ. And that came nearly 130 pre-morbid IQ, current IQ is 100. So there is 30-point decline because of accident. So until unless you are able to write properly, until unless you are guided properly to the new psychologist working under you, it will not help much to the professor. So we have been training psychiatrists, both in practical training as well as didactic lecture.